So, Professor Donal, what do you think is the best reason for people to come to events like this from the GI community? What can they hope to get out of it?
Well, they meet different people. They meet people from within their own organisation and team as well. But I think the great value is that there's a cross-fertilisation of interests and knowledge, and so it's a fantastic learning opportunity. And more than that, I think people can start to build alliances and collaborations and partnerships. You can pinch good ideas, and you can share some of the challenges that you've had in a safe environment. Those are some of the things.
So when it comes to collaboration, obviously Manchester is ahead of the game because of its devolved settlement and the way that you've been working together for quite a long time now. How much do you think other STP areas have to learn from the Manchester experience?
I think there's a lot of parallels between Manchester and the rest of the country, and certainly a lot of parallels between Manchester and the rest of the north in terms of the health of our population and the challenges that we've got in terms of staying healthy, so the public health agenda, how we contain costs within the health intervention side of the equation, and then how we provide really high quality care for people that need it. That's healthcare and social care, and what the Manchester experiment allows us to do as a nation is really to look at some of the opportunities that arise from bringing together the governance of health and social care. The budgets are still separate there, but it's moved us from being a range of organisations delivering the NHS agenda to really a coherent system trying to deliver the NHS agenda and the social care agenda there. And there's a lot of potential overlap and synergies. So IT, sharing of information is one of the obvious ones there. Organisation of services, reconfiguration of the services so that we provide reliable, high quality, evidence-based care every time people interact with the system. That's the ambition, and I think we made some steps along that journey, but it's still early days.
So, final question, what would you say to gastroenterologists and liver specialists that say this sustainability and transformation stuff, it's got nothing to do with me?
The only two sets of people who are going to make a difference to the service and really improve it are patients and carers and the clinicians, the doctors, the nurses, the pharmacists, and all the other people that make up the clinical team. Put them together and they're a fabulous team to deliver high quality. They can't print money, but they can actually make the money we have be used better, and they can also argue collectively for what is necessary to provide services to their client group.